So 50 years ago, 1976, the vision of Dr. Keon, with the help of my dad, Dr. Don Beanlands, was to create an institution, a cardiac institute dedicated to giving the best possible cardiac care, but also to research and innovation and education and training to provide the care and service to people throughout the region, and also to be a world leader.
And my father was able to do things here that would have been impossible for anybody who pursued their career at one of those established institutions. That starting from scratch and building it from scratch made it possible to do unique and extraordinary things.
So I think nursing at the Institute was always about the patients first, and that was Dr. Keon's big belief, and it transitioned through all of the staff that worked here. And so every patient could expect a very individualized and personalized experience, and for nurses, that's what really matters to them. So it fundamentally shaped how we provided nursing care. The team environment, when I first stepped here, is noticeably different from other organizations that you work in. You immediately felt like you were part of a group that had a singular focus. Everybody sitting around the table cared about the same thing, and we were all committed to improving the care for those patients.
From day one, it felt like a welcoming community. And over the years, that community has obviously enlarged, but there is still that sense of community, that sense of support, that sense that the major focus is on the patient. So whether it's on the research side or the clinical side or the interventional side, what we are doing is to improve the health of the individual patient and of the larger Ottawa community.
Their care for the patient, whether it be from behind a monitor or behind a bench, is the same sentiment and the same goal and the same passion as the nurse or the physician right at the bedside.
When this building was built, the mortar between the bricks is education. This building was built to serve the clinical needs of patients in this part of the country and really across the country, but it was also created to train the next generation of cardiologists, nurses, surgeons, anesthesiologists. And so what they've learned here, they've spread far and wide, and their patients have benefited, not just the patients in their care, but actually patients around the world.
Recognizing that we are about the people, that's why we want it to be your Heart Institute. I think my dad would be proud of that concept, that the Institute's always there for you, that the physicians are always there for you, the nurses are always there for you. It's that the team, like building the team, that everybody has a role to play. I think those things we try to carry forward.